My name is Daniel Kraft. I'm a physician. I chair the medicine track for Singularity University and am founding executive director for a program called Exponential Medicine, which looks at where technology can take the future of health and medicine, all the way from wellness and prevention to how we're going to do diagnostics and therapeutics in the future. Part of the cutting edge today in the future of health and medicine is empowering the individual as a patient or a consumer and empowering the clinician. And that's because we're moving to this age of information-based healthcare. The old model is the patient comes in and the doctor gives them the answer and gives them the prescription. The new model is I'm responsible. I'm the CEO of my own health. I need to be on top of it, both from figuring out what I might have if I'm having a strange set of symptoms, all the way to how I might manage that going downstream. Well, I think when I first heard about CrowdMed, I thought, wow, that's really interesting. Is that really going to work? Because we physicians think that all healthcare decisions and diagnostics should be made only in the clinic and the hospital, and clearly that's not the case. So the big picture in today's healthcare world is that things are pretty fragmented. Clinicians have limited amounts of time and they sort of stick to their own silos. And the referring physician, sometimes the quarterback, the primary care doc, is a challenge pulling all the pieces together from fragmented referrals and specialists. There's almost an exponential amount of knowledge out there around any element of healthcare now. The number of papers being published and guidelines and case studies is growing day by day. So it's difficult for any even very focused and seasoned clinician to keep up with the literature. Companies like CrowdMed can potentially plug into that. If I'm stumped with a medical diagnosis today, I might call up a friend of mine and say, hey, can you help me think through this patient? But if I could do that with 100 docs or 100 patients that have similar symptoms and start to put together a diagnostic picture and a therapeutic plan that's much more tailored to that individual. Well, I think it's a really exciting time right now to be in healthcare from any perspective, because we're now at this point where many of these technologies are all becoming cheap, available, faster, smarter, and more accessible. I think it's imperative that we don't just predict the future, we go out there and create it. I think companies like CrowdMed and many others in healthcare IT and many other converging and emerging fields can help do that together.